Do you frequently feel like your bones ache, even when you haven't done any heavy work? Or maybe you get infections more often than your friends. These could just seem like normal tiredness, but what if it's something deeper going on inside your body? Imagine your bone marrow, where your blood cells are made, is being taken over by one type of cell that shouldn't be growing so much. That's what happens in multiple myeloma. It's a type of blood cancer where some plasma cells, a kind of white blood cell that fights infection, become cancerous and multiply out of control. These cells crowd out healthy ones, making it hard for your body to work right. Think of it like weeds taking over a garden. Soon there's no space for the good plants to grow. So what causes these plasma cells to go rogue? Honestly, doctors don't always know the exact reason, but certain things can raise your chance of getting multiple myeloma. Think of it like a puzzle with missing pieces. If your puzzle is missing key parts like if you're older, especially over 65 if you're a man, or if you're of African descent, you might be more likely to develop it. Genetics can play a role too, like if your cousin or parent had it. But here's the twist: it's not caused by lifestyle choices like smoking or diet directly. However, some jobs that expose you to chemicals like farming or working in oil refineries might increase risk. So ask yourself, do you or someone close to you work around heavy chemicals regularly? That might be a clue worth noting. Let's play a quick game. Raise your hand if you've had any of these: sore bones, especially back or ribs, feeling super tired all the time, getting colds or infections often, needing to pee a lot, or feeling dizzy when standing up. If you raised your hand, it doesn't mean you have myeloma, but these are red flags the body gives. The cancer cells harm bones, so people may get pain or even fractures from small falls. Since healthy blood cells are crowded, you feel weak, anemia. Your kidneys can get clogged from strange proteins made by bad cells, and your immune system struggles. Imagine your body like a power grid. If one line overloads, everything slows down or shuts off. That's why symptoms appear in different parts of the body. How do doctors find out what's wrong? They don't just guess. First, they might do blood and urine tests. It's like checking a car's oil and engine code. These tests look for high levels of unusual protein, called M protein, made by myeloma cells. Then they may take a small sample, biopsy, of your bone marrow, usually from your hip. It sounds scary, but it's quick and done with numbing medicine. After confirming, treatment starts. It's not a one-shot fix. It's more like a team attack: medicines that kill bad cells, chemo, drugs that wake up your immune system, like daratumumab, and sometimes stem cell transplant, like resetting your blood system. Many people go into remission, meaning symptoms fade, but ongoing care is key. Right now, there's no sure way to prevent multiple myeloma, kind of like you can't predict a lightning strike. But you can reduce risks. Think of your body like a car: regular checkups, keep it running smoothly. If you're older or have a family history, talk to your doctor about blood tests during routine visits. Avoid long-term exposure to harmful chemicals. And stay active. Exercise helps bones and blood flow. There's no magic pill, but listening to your body and catching problems early can make a big difference. Ask yourself, when was the last time you had a full blood test? Science is making real progress. Imagine smart missiles targeting only the bad cells. CAR T-cell therapy is like that. Doctors take your own immune cells, change them in a lab to hunt myeloma, then put them back in. Some people who had no options before are now living longer. New drugs like bispecific antibodies are also showing hope. Even better, blood tests are getting so sensitive. Doctors can sometimes catch the disease before any symptoms appear. Research is ongoing, and many clinical trials are looking for better results. So if you or a loved one is affected, ask your doctor, are there any new treatments I can try? Hope is growing faster than ever,